Hello, welcome to Health and Wellness. I'm your host, Callie Collins. We have some great segments in store for you today, including our recent visit to Abington Health to talk about their new urgent care center, and many more. But first, I sat down with Cherie Perrone, who talked to me about lupus. Let's take a look. I'm here with Cherie Perrone, who is Vice Chair of the Lupus Foundation of America, Philadelphia Tri-State Chapter. Cherie, can you explain to us what the disease of lupus is?
Lupus is an autoimmune disease that causes inflammation in the body. It can affect the major organs, your heart, your liver, your kidneys, your central nervous system. So it's kind of like an overactive immune system.
Have lupus and still maintain an average lifestyle, have a family, have a job, do things in your community, things like that.
Yes. Those of us living with lupus experience something called flares. And sometimes my lupus will flare up, and that is when I'm experiencing symptoms and I feel really, really bad, and usually have to go to the doctor because that means that my lupus is becoming active, and I may need my medication adjusted as a result. So yes, a person with lupus can live very well with lupus. There are many people that have lupus that still work outside of their homes, that are very active in their communities, and they just have to pay more attention to how they spend their time and pay more attention to their bodies. It's really important to pay attention to your body. It can be very frightening to have lupus and to not know what's going on. And I know a lot of the times I felt very alone. And being a part of the Lupus Foundation helps other people know that they're not alone with this disease. There are other people out there that have it, that has experienced it, that can help walk them through some of the things that they may go through. And every single time I talk to someone with lupus, I remember being there with that initial diagnosis, and I'm able to help them get through the scary parts.
You know, Abington is a brand that's known for quality and certainly for patient-centeredness. We are taking a very patient-centered approach to our care. First and foremost, we're staffing the clinics, the urgent care centers rather, with the best trained, most highly qualified physicians that we can find. People actually are coming to work for us because of the Abington name. They want to work for Abington. So I can assure patients that they're going to get the best quality experience possible. But I think we provide a niche right between those two things. For urgent issues like simple lacerations or sprains, strains, if you think you have an illness like a sore throat or a flu and you can't get in to see your primary care doctor, we are going to have on-site radiology, so we'll be able to rule out fractures right on site. We'll be able to do chest x-rays, look for pneumonia, things of that nature. We obviously can't do CAT scans or MRIs at the facility, so things of a more serious nature should be seen at the emergency room. But you know, it's really important to us, if we feel that someone comes in and they're not appropriate, that we get them connected to the right environment.
Well, we are attempting and we're going to succeed in being very convenient for patients, and we are going to be open for 12 hours Monday through Friday, 8 a.m. to 8 p.m., and we're also going to be open on Saturdays and Sundays from 9 a.m. to 5 p.m. to service the community. We are opening 2 locations, one location in Feasterville, Pennsylvania on the corner of Bustleton, Pike, and Street Road. That will be our first facility that we open. That urgent care center will be open in the March timeframe. And then we have an additional location, a location on 1842 Bethlehem Pike in Flourtown. And that location will be open in late spring.
We fail to consume enough calories every day, we will have a hard time getting in an adequate amount of vitamins and minerals, and our body could become malnourished. So we have to work really hard to figure out what our calorie needs are. Even with weight loss, it's important to not consume too few calories. We need to make sure we have sufficient vitamins and minerals, as well as our macronutrients and micronutrients. It is also can be a problem if we are eating too few calories, because our metabolism will have to adjust to slow down if there's not enough to fuel it every day. Most of our calorie needs go towards our heart, our lungs, our brain, all of those really important functions. And if we aren't consuming enough calories every day, the body has to slow the metabolism down to make sure that those needs are being met. This does not help with weight loss. I'm Flavia Herzog-Liebel, registered dietitian for health and wellness.
Do you ever wish that you had somebody on your side when dealing with health insurance issues? Marty Rosen, a co-founder of Health Advocate in Plymouth Meeting, does just that. I sat down and talked to him. Let's take a look.
About 12 plus years ago, my partners and I founded Health Advocate with the notion that there was a void in the country in terms of helping people navigate through healthcare and insurance types of issues. So when you think about it, in our country, we have lawyers who are available to help people with legal issues, or accountants to help people with tax issues. But when it comes to working through problems, resolving issues for people as they navigate through healthcare and insurance, there really wasn't that type of go-to entity. The basic service, the advocacy service, is built around providing a personal health advocate where employees have access, and their families, both their spouses, their dependent children, and most notably their parents and parent-in-laws. We have expanded family eligibility as well, where if they run into any sort of issue, a billing issue, finding a doctor, getting an appointment with a hard-to-reach specialist, resolving a claims issue, anything imaginable that could come up that could be a roadblock or a problem for the employee or their family member, we're going to take over. We're going to do it on their behalf and resolve the issue. Well, our initial business, and obviously still is the case, is we make our programs available through groups, employers, other groups. I mentioned some insurance companies make it available, etc. Additionally, though, we recognized years ago, because we got calls from people who were not part of a group, and they had a problem and we didn't want to turn them away. So we have a consumer version of what we do. It's called Health Proponent. And individuals who are not affiliated or not getting our coverage through an employer or a group-based program could buy it individually. And we have a program available that they can do that. And we work with individual consumers literally who call us up. Well, if you go to healthadvocate.com, and we have our 800 number there, and just call us up, and we'll be happy to help, whether it's an employer who's looking to offer both our advocacy or our wellness or our EAP or any of our other programs, or an individual consumer. We are in business to try to help people, and we've built our reputation around doing that effectively. So we'd love, if somebody has a need, we're here to try to help.
Well, thanks so much, Marty, for being with us today.
Thank you for having me.
Thank you to all of our guests, and thank you for watching. Make sure you like us on Facebook and follow us on Twitter. and we'll see you next time.